Hey there, PT and PTAs. My name is Stephanie Audish, and I'm a doctor of physical therapy. Today, I am going to talk about the OCS exam, or the Orthopedic Clinical Specialty Exam. I'm talking about this because I signed up and I will be taking the test in about 5 months. So I wanted to talk to you about what the exam entails, what kind of study materials I'll be using, and in the following weeks, we're going to be going over studying together. So, the OCS is a 3.5-hour exam that creates a clinical specialty for licensed physical therapists. Now, what this clinical specialty does is it advances your knowledge base, advances your skill set, and shows companies and shows patients that you are committed to lifelong learning, that you have taken the time to study for yet another board exam and get another credential, another certification, and here specifically a specialty to improve your patient care, improve your patient experience. Understand that you're always going to be using evidence-based practice along with your clinical expertise. The OCS helps physical therapists to advance their knowledge in anatomy and physiology, advance their movement analysis, their biomechanics, their ergonomics, and all of the extraordinary conditions where you are treating the patient as a whole rather than just isolating the injury itself. So when someone comes to you with an ACL injury, you're not just treating them for the sprain of the ligament. You're looking at their gait patterns, their movement patterns, and their day-to-day activities. Now, as a new physical therapist to the field, you may have a lot of experience with this because it is something that is taught to you in school. Gait and functional movements are something that we integrate into our examination all the time as physical therapists, but the OCS helps you dive deeper and helps you get a better understanding and more of a foundational knowledge where you're actually getting advanced skills. So let's talk a little bit about how the exam is broken down. So like I said, this exam is a 3.5-hour online-based exam. Its main component is case scenarios, although there are multiple choice questions that are more on anatomy and physiology. There's also a lot of clinical-based clinical judgment questions. So 70% of this exam is patient and client management. So how are we going to examine, intervene? How are we going to assess this patient? And then 15% is going to be more of that knowledge base, that what is the ligament that attaches X to Y? And then we have 15% that are our roles and responsibilities. As a clinical specialist, you are seen as a leader in the field. You are seen as someone that has a more advanced knowledge and advanced skill set. So it is important that they also test on our roles and responsibilities as a physical therapist. Breaking down the exam even further, we have 20% of the exam that's going to be examination, evaluation, and diagnosis. Another 20% is going to be interventions, prognosis, and outcomes. Then we have orthopedic physical therapy practice, medical and surgical interventions, pathology and pathophysiology, pain science, movement science, anatomy, and physio, which all each account for about 10% of the exam. So when we're breaking down the actual case scenarios, the actual anatomy, physiology, the whole realm of this test into body part, we are going to see about 20% of this exam is going to focus on the lumbar spine. This is because this is one of the most prevalent things we see in the clinic. And as someone who is studying to take a clinical exam, a clinical specialty exam, you are a practicing clinician. You have to have had at least 3,000 hours of practice with orthopedics itself, with the last 500 hours being in the last 3 years. So a lot of the body parts are going to be broken up and weighted based on their prevalence in clinical practice. So we have 20% of this exam focusing on the lumbar spine. And then we have about 15% focusing on the shoulder and shoulder girdle. We know this is a complex area. We treat it a lot. So it is going to take a good chunk of this exam. 13% accounts for the cervical spine. 12% is about for the thigh and the knee. Then we get 9% into the leg, ankle, foot, 7% into the hip, 7% into the pelvis, the sacroiliac joint, coccyx, and abdomen, and dropping low to our 6s and 4% from then on to the other joints. So when you are studying for this test, it is important to take a look at what is the bread and butter? What is the heaviest amount that's going to be tested? I'm going to focus most of my time and attention and the nitty-gritty details on those areas. Because if I know this is about a 200 question test and there's only 3% on the head, the mandibular area and the cranial mandibular area, I'm not going to spend that much time fixating on the nitty-gritty. I need a general and a broad understanding and conceptualization. But if I'm looking to pass this exam, I'm going to be focused on the heavier weighted aspect of the exam. So anytime it comes to a standardized test, there's a few different tips that like to be given. One is answer the questions you know that you are confident with, answer and move on. If you find yourself getting stuck on a certain question, getting frustrated, thinking that it's going to take too much time, just skip it. I know when I took the MPTE, I was never someone who skipped questions on a test. But if I read the first couple words of a question and I was already getting tired, getting frustrated, getting nervous, I marked it and I skipped it and I came back to it at the end. During your breaks, give yourself pep talks. Give yourself pep talks and breathe. Make sure you eat, make sure you hydrate. Take bathroom breaks if you need it, if you're allowed to in your exam. But also when you study, make sure you're studying very similarly to the time you're going to take the exam and the duration so that you have the endurance. When you start to study for a 3.5 hour exam, you might not be able to focus for 3.5 hours. But what I used to do was turn off my cell phone or set an alarm on my cell phone and manage that as blocks, just like the exam. So if you get an 1.5 hours for the first block, my phone would be off or on a timer in a different room for an 1.5 hours until I knew I could take a 10-minute break. So work up, just like we teach our patients to work up to their goals, work up to your goal with this too. All right, lastly, I'm going to talk about the resources that I'm going to be using to study for this exam. First and foremost, there are the clinical practice guidelines that are on the APTA website. If you're going into any of the research, evidence-based practice, all of the CPG clinical practice guidelines are on there for all the different body parts. So focus on the musculoskeletal ones and definitely the lumbar ones, chronic pain, lumbar, low back pain, radiculopathy, all that kind of stuff. Focus on those guys, okay? I was also researching and found out that it is also good to stay up to date with the current research that's out there. So anything that's in the Journal of Orthopedic Physical Therapy and Sports, all of that is also important to keep up to date with, as well as those clinical practice guidelines. The AOPTA does have a current concepts book that they do release every 5 years, which does break it down into body part 2. So that's also something that you can look into getting. I personally am not getting that at this time. I'm going to take what I have from my old MPTE books. I took the test in 2020, CPGs. I'm going to be using my handy dandy orthopedic book. You can see how big this guy is to get my foundational anatomical things, because anatomy hasn't changed all too much since 2020. So I'm going to be using this as kind of my guide for the anatomical special testing, things like that. I also purchased a few different books from Amazon, and the first one that I am excited about because I have just started reading through it is this OCS Exam Prep 24 to 25. Now it says it has 546 practice questions in here, and as I was reading through the beginning, it really kind of breaks down what's going to go on in the exam. And it also, what it does, what I like, is before you get to all the practice exams, practice questions just flat out, what it does is it has a little case scenario and it asks a few questions or it describes the different aspects. So if it's talking about red flags, it has a case scenario and then it talks about the red flags. So So far, I really like this book. We will be studying from this book together in our follow-up videos. And then at the end, it does have those exam questions in there. Now, of course, these are not exam questions. These are practice exam questions. But that is one of the tool guides I will be using when we're going through these videos. And then we have this little tiny ortho notes guide by Gulick. It's the 5th edition. And so this, I don't know if you can see, but it has little tabs, and those little tabs all have the red flags, so alarms and alerts, shoulder, elbow, wrist, hand, spine, hip, knee, ankle, and foot. So this actually, if you go in, it does have some anatomy, and then it goes into trigger points, nerve, joints, all of this. So it is kind of, and it has all the special tests that are prevalent. So it's kind of a pocket guide for when you're out treating patients and you need a quick little reference if you haven't seen something. This is great to have, and I will be incorporating this into our studies as well. And lastly, I haven't gotten to dive too deep into this ACE, the OCS. It says it's a 100-item practice test, and literally looks just like a practice test. It does have some references in it, but it looks like it's straight up just question with answers at the end. So it's broken down into, I think there's a case scenario. There's 10 questions per case scenario, and then the answers are broken down. So it probably does have case scenarios based on body parts or based on the OCS exam breakdown of the most relevant topics. So I haven't even dove into this one quite yet, but I will be using this as a study guide too. So I hope if you are going to study for the OCS, or you're just a physical therapy student and you need to know this information as well, I hope that you join me in my journey to taking the OCS. Let's get this A, let's pass this test, let's get another notch under our belt. And I'm super, super excited to take this journey with you. Thanks for coming to Studying with Stephanie, and I'll see you next week.